Hello and welcome. Today, the Scorpion community has come together for a virtual town hall to update Nevada State College students, faculty, and staff on the COVID-19 protocols and academic plans for a successful fall semester. My name is Amber Lopez Lassiter, and I have the honor and privilege of serving as your chief of staff here at the college. And I have to say, it is so amazing to be back on campus with students. So the whole reason that everybody is here. We are very excited to come to you today with our college leadership, and we will answer questions that you submitted, and also you're able to submit questions in real time. So you'll see at the bottom the Q&A feature. Please feel free to use that. This Rockstar panel will also provide details on resources available to you today. But before we get started, I want to quickly introduce who you'll be hearing from today. We have our beloved new, who seems like she's been here a good amount of time already, President Dr. Darian Pollard. We have the amazing Nevada, feel free to clap. We have the amazing Nevada State Student Alliance Executive Secretary, Lisbeth Vega Santiago. Our fantastic Provost and Executive Vice President, Dr. Vicki Shields. Our dynamic Dean of Students, Dr. Stephanie Coleman. And our wonderful Vice President of College and Community Engagement, Dr. Edith Fernandez. Welcome, everyone. So again, we encourage you, use that Q&A function. We also have some folks behind the scenes. We have Amy Evaluna, who's our Interim Director of Community Equity, Diversion, and Inclusion. We have Danielle Welch, Campus Engagement and Special Events Manager. You'll see them showing up as Nevada State College. We also have Michael Johnson, who is our Interim Director of Clinical Partnerships with the School of Nursing, and our very own Kevin Butler, Vice President of Business and Finance, who will be able to field some of those questions behind the scenes. So away we go. Dr. Pollard, why don't you kick things off for us?
Well, let me start off by saying good morning and join in and welcoming this fabulous panel. You all are all stunning as well. So I want to thank you for that. And I really want to also thank those folks behind the scene who really not only organized this event, but made sure that we come off looking very much in charge and knowing what we're saying at all points. So I want to thank you all for that. And I also know that I noticed that Dr. Amber just set us up when she called us rock stars. So I'm fully prepared that we're going to start us a music group after this. So that being said, let me just offer a couple of comments of introduction. Then we're going to go right into this moment so that we're respectful for your time. I want to draw your attention to the theme for this particular town meeting, and we're calling it, this is learning and leaning into this moment. And I remember the other day, Dr. Deed asked me, well, where'd you come up with this? You know, why is this a relevant title? And for me, I want to share with you a couple of ideas about this. One, that we know that the COVID-19 experience in this pandemic is certainly a defining experience for us, but we are not going to be defined by COVID-19. In fact, what I would offer to you, and one that I think all of us would agree, that embracing our mission, our purpose, our presence is so necessary right now. Our students and our community need Nevada State College in more ways than we can even imagine. And for us then to lean into this moment, to show exactly who we are, to announce our value proposition is something I think is particularly important. And I'll also tell you, and maybe, call me a little crazy, as I attempt to be a student of history from time to time, we have experienced this moment before. I would encourage you just by simple Google. I was doing this with my son the other day because he couldn't quite understand some of the frenetic energy and paranoia that's going on right now around the vaccination and COVID-19. So I said, let's just Google up the Spanish flu. Actually, he says, search it up. Let's search up the Spanish flu. And we looked at images of propaganda that was out at that time surrounding the vaccination process, and those at that point who were very much concerned and anti-mask as well. So I think here we are almost a century later, grappling with the same issues again. I would tell you that we know how to deal with this. Certainly, we've never seen it, I think, quite as vitriolic, and I think it's a reflection of the times that we're living in. But I'll offer to you that We need to place this moment in context and really lean into our mission as an institution. I would love to see, as I thought about this morning on the way in, it'd be a great opportunity to have a panel where we might have history faculty, political science faculty, and nursing faculty really talking about this from that perspective of this moment that we're in. I think it could be very provocative to have students and colleagues really be engaged in that conversation, because I think our memories are short and we don't always know the history behind things. So I'm going to ask you, as we are learning and leaning into this moment, that we be more patient with each other. This is literally an evolving landscape as we're in it. As I was sitting here, I received an email about some changes and some other things that are happening. So a lot of us who are trying to be and are responsible for communication, we don't know everything that's happening. So I ask you to have some patience, some grace, and stay tuned to communication, because communication is dialogic. It's not just one person talking to, it's also the receiver receiving that communication. The important part is that we want to, for employees, get to that 70% threshold where we have employees who are vaccinated and we have that in our system. That's important because then the weekly testing will be reconsidered. So I really want to ask us as a college community to be very intentional about that. I know that there seems to be a lot of information. I want to thank Eric. I want to thank Adit. I want to thank everyone who's been really shepherding this process. You all are phenomenal. I know you're fielding oftentimes difficult questions and having to help people process their emotions. And let's be quite honest, oftentimes you all on the receiving end of sometimes folks less graceful behavior. So I'm hopeful that as a college community, we lean into this moment and really embrace who we are. So that's my opening monologue. I did have my cape today as well, so I'm hopeful that that doesn't portend anything bad, but I'm hopeful that I can pause now and turn it over to Dr. Amber, who may have a couple questions that she wants me to speak to.
Fantastic. And the cape looks great, just so you
Thank
know.
you. Thank you very much.
So, a question that we saw coming in ahead of time was related to telecommuting and our telecommuting policy. So the question is, can you please provide an update? A lot of folks are feeling like they're more productive at home. And what plan does this institution have to formalize this option?
Yeah, I really appreciate that question, because actually during my interview, I think I was asked that at least twice. What's my perspective, opinion on telecommuting? And what I'll offer to you is I want to decouple that question the way it was posed. The colleges need to look at a teleworking alternative work schedule process and policy, and then how we promulgate some actions as a result of that. And then the other part about is that what is the optimal things you need as an employee to show up in your workspace? Those two things may not be the same, because for some of us, working at home we think bring out the best in us, but we also know that there are a lot of efficiency studies that suggest that may not be the case as well. Many of us may not work in environments that are ergonomically correct. Many of us may have competing things that are happening in our home. Others of us may just simply long for the socializing that happens in a workspace. I love listening to people in the hallway, and even as I'm new, I find myself laughing and walking around barefoot. I've got to stop doing that. So there's a whole thing that's very important about this moment. That being said, if you had talked to me before the pandemic, I would have been one that wasn't necessarily in the biggest support of telecommuting. My opinion has been revised in that space. So ironically, I literally have on my desk 2 articles that I am reading right now, both from the Chronicle of Higher Education. One is 5 ways higher education will be upended. And it talks about these macro trends that we as a higher education space have to be responsive to. And then the other article I have is 5 questions to help you develop your remote work policy for now. What I love is that these 2 articles literally are a dichotomy of several issues, and how we as an institution have to start thinking and preparing for this, both in terms of what we're experiencing right now. So we can't write a policy that's dependent on COVID-19. At the same time, we wanted to create a policy that's reactive and responsive to what we need to keep employees engaged and provide the best service to our students. So while I am always about making sure that we have an environment where employees can thrive, my #1 conversation about this policy is going to be driven around what's in the best interest of students, how do we advance our mission, and how do we create opportunities for multiple ways of showing up in the workspace, because every job is not going to be able to lean into a teleworking position. Every role may not benefit from that experience, and every employee may not want that, even for those who may want it. So it's a very complex issue. My hope is within a couple of months, I'm going to have some draft of some work that I'm going to start charging some people to work in, but I think I'm just on day 14. So give me a little bit more time, and we're going to hopefully see some things before the end of the semester, some draft policy language that we can look at. And then I also have to look at how our policy aligns with whatever guidance we have from INCHE as well.
That's great. And also some questions around vaccinations and religion. So vaccinations are against my religion. So I'm wondering if you have an exemption form due to my religion, or if I can take online classes.
So the short answer to that question is yes, but some of you probably realize I don't always like short answers. So let me step back for a second and just offer a couple of thoughts. The prevailing medical evidence is that vaccines reduce illness, reduce hospitalizations, and reduce death. Let's be very frank about that. I literally just tweeted out a few moments ago about why I chose to be vaccinated. This was after having thoughtful conversations with my healthcare provider, having intentional conversations with my family, reading, because I think that's a part of what one should have to do when you make decisions about your healthcare. So I made that decision for me, my family, my community, because I think there's something about all of us being in this together. So I'm hopeful that you will look at all those issues as it relates to you and your family, because I'm ready to get to whatever this post-COVID-19 reality looks like, where we don't have to wear a mask all the time, that we can show up in spaces differently, that we're always conscious about what might happen, because it won't be this pandemic is the only pandemic. What we know and what the science is telling us is that this is going to be something we will have to grapple with again. So I'm hopeful that employees and students, certainly there are, we recognize religious freedom. We recognize healthcare decisions that may not align with vaccinations. So there are forms that you can see on our Dean of Students website and other places. We're actually, based on this conversation we've been having, merging some of the different places where you can find information about the policies, processes, and procedures. But I want to hopefully speak from a personal place and suggest that vaccinations are the things that we know right now that might help us get back to or get forward to the reality that we want to see, where we are safer and healthier as a community. So I hope that you would choose to take advantage of that, recognizing that is certainly a personal choice that each and every one of us has. Thank you.
Thank you. And I love the way you depicted it, moving forward towards, because we're going in that direction. One last quick question for you before we hear from Lizbeth. Can you talk a little bit, people wanting to hear from you? How are you communicating with the campus?
I'm trying to talk everywhere. So you all are seeing Monday messages from me. We've done the last couple of them. Oh boy, look at that. And I was in my golden block again. I'm trying to keep up with Dr. Vicky on this. But what I'm going to suggest to you is that I know some of you are going to get sick of seeing my face, because I'm sick of seeing it as well. So we're going to try some things that are going to be what the word I'm going to say, written. I'm walking around. I have yet to get to some of the other buildings on campus. So that's one of my goals for next week, putting my tennis shoes on and walking around and just getting to see people in their spaces. And of course, feel free to communicate with me through social media, email. I got a lot of that right now, but please, social media is a great place to kind of send me a message. A few of you have already found that out. Give me a call. I welcome it. And if you think of other places that I need to, or different strategies, please let me know. I'm happy to engage in that.
Wonderful. Thank you.
Thank you.
Lizbeth, so great. I've seen you in person and it makes me so happy. So glad you're able to join us today and bring that student perspective.
Yes, hi everyone. Good morning, buenos dias. I'm so excited to be here with you all today. Like as Amber said, we've had some events this past week welcoming students. So I'm here today representing the Nevada State Student Alliance, or NSSA. I'm the current executive secretary, and we're just so excited to be back on campus and seeing students mingling in the student lounge and out in the cafe. We've dedicated our entire summer to planning so many events for you guys. So we're so excited to have you guys back. We are offering a little bit of everything for everybody. We have hybrid events, in-person events, online events. So whatever you may choose, you are more than welcome to attend those. We encourage you guys to attend those. So yeah, I'm just really excited to be here with you guys and provide a student perspective as well as a student leader's perspective.
That's wonderful. Tell us a little bit about what you would tell brand new students who this is their first time they've been on the campus of how to get involved and how to be engaged.
Yes, that's a great question. I definitely encourage all students to get involved. I know sometimes that can be intimidating, so maybe something virtual would be a good segue to come and get involved and come meet us. But I always encourage students to just come visit us in our office. If you come visit our office, you can always hang out in there. Our office is located on the 3rd floor of the RSC Plaza, and we have so many things for you guys. We have computers for you guys to do homework. We have snacks. We have a bunch of different things. And, you know, if NSSA isn't your thing, we have so many clubs on campus, and clubs have remained active throughout this entire pandemic. And I know that most clubs are offering their meetings as well in a hybrid format and an online format. So we have everything from an anime club to a dreamers club to a Black student organization. So there's a little bit of something for everybody. So I definitely encourage you guys to come and ask questions. And you can always keep up with our events on beengaged.nsc.edu. And I just want to see you guys on campus. It's so exciting for everybody to be back and to run into people in the hallway. As President Pollard said, I think that that's like one of the best things about being a student, seeing everybody come back, and new students and returning students. They've all just been coming out to our events and having lots of fun.
That's fantastic. Now, share with us about what kind of support there is for documented and undocumented students here on campus.
Yes, so there's lots of resources here on campus. We now have an undocumented resources coordinator, Mariana, and she just started this week. And so she's available as a resource. We're so excited to have her. And then also the care team, our care team.
Looks like Lizbeth may have frozen. Okay, we will come back to her as soon as her Wi-Fi catches up. That's still one of the drawbacks of this virtual space, but that's okay. Dr. Shields, tell us a little bit about what's going on in your world.
Oh my goodness. So good morning, everyone. I'm so excited to just give some updates kind of from the faculty perspective, kicking off the semester. Our faculty have done so much in their commitment and their perseverance and to our students and to our mission. It's really been phenomenal. Recently, the CTLE put out an annual report, and I'm very happy to report that 100% of our full-time faculty over the last year were part of professional development offered by the CTLE. And that's their commitment to their pedagogy, the quality, moving online and giving it the same quality that they do in person. And that commitment has just been amazing. We've also had 8 faculty members complete the best practices in online teaching. That was an asynchronous course offered through the CTLE to improve online teaching. So many of our brand new faculty have been part of all of this. So we love your commitment. And then the AQ completers, I have to give a great shout out. 27 of our full-time faculty completed the AQ program. You know, this is close to my heart. I fought really hard for a couple years for us to be part of AQ. And I'm just so happy that our faculty took full advantage of that. Because we're a small school, we won't be able to do it every year, but we're really shooting for every other year because you've told us how much it meant to you, and we know what a great program the AQ partnership is. So that's a huge success. You know, our heartfelt welcome to all our new employees. Since June 1st of 2021, we have 12 new full-time academic faculty, 17 administrative faculty full-time, and 6 full-time classified employees. So we're growing. We don't know each other yet as much as we would have in the past, but that's going to change because it is still a small enough campus. When we're all back, we'll be bumping into each other and having great informal chats, which is the fun part. In the world of grants, our first HSI STEM grant has just been secured through NSF. That's huge, National Science Foundation. It's about as big as it gets. The effort is led by our own Jennifer Edmonds. So it's a collaborative effort, but she led the charge on this and we just secured that grant. Also, a state-funded education grant was secured by the School of Education. And this is a mental health grant. And how we're using our portion is to develop a proposal for a master's in school psychology. And there is the need in the state for school psychologists and counselors is amazing. I mean, these professionals have thousands of students per professional. So anything we can do to shore up what goes on in the schools, we're certainly going to do. And speaking of master's proposals, the master's proposal for nursing administration is well underway. Thank you, nursing faculty. And so we're going to be reviewing that at the provost level and at the CFO level very soon. We have a meeting scheduled and I couldn't be more excited about that. So like teaching, we're going to contribute in an even broader way to healthcare than we already are. And the week coming up, I have the privilege of presenting the BS proposal in chemistry for the Board of Regents for final approval. And so very soon that will be our next bachelor's level degree. So I could go on and on, but I want to start with a question that was submitted ahead of time. And the question was paraphrased: if I'm a faculty member who teaches completely online, do I have to be vaccinated for spring 2022? Let me start this way. It's a complicated question, actually. It's not a simple answer, and it's not exactly the same answer as the student answer. So I'm going to start like this. None of our full-time faculty contracts are for completely online teaching. So I want to start there, except for the RN to BSN program. All faculty contracts were not full-time online. Okay, so I'm going to start there. What we're going to be doing is trying to get back to a more in-person schedule. I would like a goal of between 50 and 60% in-person classes in the spring. So the scheduling for the students' benefit is what's going to dictate how we teach online, who teaches online, and how much they teach online. And so there'll still be a lot of remote teaching, but that doesn't mean faculty members' entire load will be online. So we're going to start with student needs. We're going to scaffold that. We've got to take care of our residential students. We've got to take care of our first year students. We got core classes. We're going to make sure that the freshmen are having their best in-person experience that they can. And there's a lot of scaffolding on what needs to be offered so that we are offering our mission. Now, the students, almost all of them will be vaccinated. Almost all the faculty will be vaccinated too. So although we'll still be in a COVID environment, it should be a very safe one, and we will do everything to mitigate that. So it's the best for our students to have a mix of at least 60% online, in person. And so that's where we're going. So we'll start with scheduling in the schools for the best thing for our students, and then work to what faculty are teaching remotely and how much of their workload they're teaching remotely. And I know that's a long answer, but it's not a simple question. Amber, are there other questions for me?
Thank you. We do have a question here on NSHE vaccination mandates for students and how we think that could potentially impact enrollment. So this person says, I'm very worried we'll lose many students, especially in specific groups.
Yes, I mean, we're all worried about that, of course. It is impossible to tell at this point because registration hasn't started. You know, we're hoping that we all embrace what President Pollard was talking about. This is what the science tells us is the safest and best way to go. And if we go in that direction, then you know, hopefully enrollments won't suffer too much. You know, I'm hoping people don't leave because of this issue, because we will do everything in our power to keep you safe. A student can always put together an all remote schedule, which is different than the question I answered before.
That's right. That's right. Well, thank you. Now we have the opportunity to hear from Dr. Coleman, Dean of Students.
Good morning, everyone. I hope everyone is enjoying this beautiful day. I actually believe that I have the best job on campus because I get to work with as many students as humanly possible. The areas in my office support students in the classroom and engage with students outside of the classroom, and that engagement is intentional. We know the first 6 weeks of the semester are critical for all new students as they determine how do they best fit into their new normal. The past 3 weeks have reminded me why I enjoy working on a college campus, because of all the vibrancy and energy that I just kind of felt from the students. On August 18th, we welcomed 109 NSC students to campus housing. It was exciting to hear students excited about their decision to live on campus. No more commuting. I can join clubs, I can work with my professors, I can participate in group work, I can use the library, I can eat in the cafe. It was even more exciting seeing many of them participate in the Welcome Week activities. Welcome Week had something for everyone, and everyone wore their masks properly. In spite of the mandates and the virus, we're still providing an awesome college experience safely within the guidelines. Be on the lookout for a countdown clock on the screens on the website, and maybe some version of the clock in RSC. Just a fun reminder for students, if you receive your vaccine shot by October 1st, you'll meet the November 1st deadline to register for classes. You'll have no problems getting the classes that you need. I've received a few questions about exemptions and masks. Students will be able to submit a vaccine, religious, or medical exemption using the MedProctor site. You'll go to the MedProctor site, create an account, and upload your documents. The process is evolving as we work to be in sync with the other college campuses in the state. So information will be coming forth soon. And the goal here is to make sure that we're just in step with the other campuses. On the same street as that question is, if I submit a religious or medical exemption, will I need to submit a weekly negative COVID test? The college system has not yet made a decision on this alternative requirement. Again, we're working to stay in step with the other colleges, and I hope to have a response fairly soon. This week, you should have received the first weekly email from me. Look out for more weekly emails because I will be answering questions and providing updates on information as it becomes available. Another question asked involved the mask requirement. Will students still need to wear a mask after November 1st? Yes, the mask mandate will continue through the spring semester. If something should change with that mandate, I will definitely communicate that out to the NSC community. Before I turn this back to Dr. LL, I just want to remind students that if you are feeling overwhelmed or mentally or emotionally stressed. Laura Hinojosa is our case manager for the care team. She has a portfolio of support options on campus and in the community. And this year, I'm happy to introduce Anise Pruitt as our licensed counselor. She will start her intake process to start working with students next Tuesday. But for now, if you want more information how to reach out to Anise, please reach out to Laura to connect you. And Dr. LL, I'll turn it back to you.
Thank you. Thank you so much. I love what you said there about the vibrancy of campus. I'm convinced 100% working here is the fountain of youth. So
Yes.
staying engaged, staying plugged in, and being around this much energy is really, really fantastic. So thank you for that. Dr. Fernandez, you've been pretty busy.
Hi.
Tell us a little bit about what's going on in your world.
Thank you, Amber. Again, my name is Edith Fernandez, and I'm your Vice President for College and Community Engagement. This is a rather new division. It includes the offices of marketing and events, public safety, career services, all our diversity efforts. And it's been a pleasure working with these different offices. And I will say this, our emergency management functions have kind of taken front row seat. And, we've been in a state of continued emergency management for quite some time. I myself have had to lean into my colleagues. I'm grateful that we've been able to come together. We're sharing information simultaneously. We're learning from each other, leaning into each other. We're stretching ourselves. We're using our networks so that we're thoughtful. We're thinking about how to get quick responses because our common goal is to mitigate the spread of COVID-19. And safety is top of mind, and not just safety on an individual basis, but the safety of our community. And it's wonderful to see that in action. We're drafting new protocols, urgent communications, and just again, thank you for being patient and giving me your grace. And I like to connect with that messaging that Dr. Pollard kicked us off with. We all need it. And so I'm glad that we've come together. I also marvel at the positivity, the creativity, the grit that the whole Scorpion community put on display. And as Stephanie said, we saw that in the last 2 weeks with our welcome back activities. It was fun. And I needed that moment of just having fun. Like I was coloring with students and I didn't realize how much I just needed to be with folks and community and also just do something that was fun. So thank you for that. We're doing this. We're navigating through this. It is clear. And we're doing it by putting the well-being of each other up front. So you saw we're doing these activities outside. People were wearing masks. People were social distancing when they could. We're taking care of each other. And that gives me that renewed energy to kick off the semester. So I'm glad we're doing it together. Before I get into my next set of comments, I want to preference by kind of recapping, where do we get our information to make the decisions that we're making and set the protocols that we're creating? So to recap, remember that as institutions, we take cues from the CDC. That's kind of at the federal government level, and our governor decides what from the CDC are we actually going to put into place in our state, right? This is the guidance then from the CDC determines what our governor is going to mandate. So specifically, Governor Sisolak has put out various emergency, state of emergency directives. And just a reminder, the newest one that we have is that all Nevadans, not just state employees, but all Nevadans must wear a face covering. And that includes covering your nose and your mouth. So just kind of want to remind folks where we're at with this. This is not a request, it is a requirement. And the most newest directive is requiring unvaccinated persons not only to wear a face covering indoors, but outdoors as well. So know that those directives are still in place. As a reminder, when it comes to mitigation efforts such as social distancing, and room capacity, that guidance comes now from the county. So the governor said each county can decide what social distancing measures, what room capacity measures each county will implement. So in essence, we get guidance from CDC, the state, the county, and then NSHE steps in to help provide guidance on how do we apply those in the higher ed setting. And so know that we're in constant contact with all of just NSHE as a whole, and that includes all of our sister institutions as well, as we're crafting these policies, as we're crafting these responses. This brings me to just kind of, again, remind everyone, one of the newest directives from the governors regarding testing for state employees. And I'm just sharing this language because even for myself, I had to remind myself, what's the name of the newest directive? You know, what is the date? We're all doing this learning together. So that testing for state employees is that those who are not fully vaccinated must be engaged in weekly testing for COVID-19 and provide proof of testing. And that testing must be submitted to the Human Resources Department. There's a very small number of employees that are 100% of their time is out of state. Vicki just went into a rather lengthy explanation of that. That's a very small portion, and we're identifying those, if any, are applicable to our institution. So as a reminder, if you're working from home, you're in our state, you still do need to test weekly and provide proof of vaccination. Now, for our Nevada State College employees, this testing directive is currently in effect. Now, Eric from HR, he sent out the newest explanation of what this means on August 31st. So yes, there's a bit of a delay there, but everyone should have received this August 31st. It goes to all of our employees, part-time, full-time, student employees, academic, faculty, administrative, classified staff, all of our employees. You should have received detailed information on how to submit your proof of vaccination. Note that we're still working on the testing policy piece of this. We're hopeful within a couple of days, we'll have even more clarity on what this protocol is. We want to be able to give you specifics on testing days, testing sites, and procedures for providing proof of these test results. That is soon going to hit your inboxes. These details, again, they're being developed in coordination with NSHE, and we're in constant dialogue with all our sister institutions. So just wanted to share a bit of that and turn it over to Amber to see what questions have bubbled up.
That's great. And I think, you know, when we first started moving into this brand new COVID space, you heard the pivot. That it's like, you can't even say that word anymore. And now we're in this new territory where everything is evolving in real time. And I loved your point, Adit, about patience and grace and really digging deep, because I know the level of frustration when it's not crystal clear, but there is so much coordination going on at the college level, as well as with NSHE, the state, and it goes on up. So I love the way you depicted that. We did have a staff member who oversees support services who asked if you can provide some additional clarification about social distancing. So how can we continue to promote social distancing, because we know what value it brings in stopping the transmission of COVID-19?
I love just even how this question is framed, because it comes from like, what can I do to help others? So beautiful. Thank you for even framing it like that. As I stated earlier, we're getting guidance now from the county on social distancing and room capacity. Note that our classroom spaces will be to capacity. So I do want you to know that. But this question adds this added layer of like, well, where can we promote social distancing where we can? Events is a great space to do this in. Again, Welcome Back Week had events indoors and outdoors. You'll even see from some of those pictures, we did some intentional limiting the number of folks to a table as an example, doing as much as possible outside. So we work with any entity on campus. This is Danielle's team, the marketing team. We pull in experts from emergency management for our campus, that's Greg May, to like work through, hey, I have this idea, I want to host this event. Of all the things that we can do to mitigate the spread of COVID, which ones come to mind? Which ones can we plug into this event? Social distancing is one of the easiest ones. So know that we're constantly reminding folks, although it's not a mandate, social distancing, it is part of that menu of things that we can do to mitigate the spread. So it should be something that we do automatically. And just last week, we met with NSSA to talk about Scorpions Calling. What can we do to make that as safe as possible? We've got some great ideas. And one of the things that came up is putting markers on the floor. They plan to serve food. They plan to do events that require kind of like a lineup. Let's put markers on the floor that encourage the social distancing. So I love that we're dialoguing and coming up with these ideas. And that, again, this comes from a position of what can we do above and beyond? So thank you for that question.
Absolutely. And I've got a quick question here, but someone asking, I got my first dose of the Pfizer vaccine. Is it too late? Can I still get my second dose in?
So yes, you can, as long as you received your first dose of the vaccine more than 28 days ago in Nevada. So you can still get your second dose at the clinics at Nevada State College. And I know there'll be a flyer noting, I think we have 3 more on our campus. Also know that on our coronavirus website, we have links to all the clinics within Southern Nevada as well. So yes.
Great, great. So we have a question that came in, and I know there's been a lot of discussion around this. So Darian and Vicky, what is the campus goal for in-person instruction in the spring? If a faculty initially chooses in-person instruction, but the COVID situation changes again, will faculty continue to have flexibility to revert to remote instruction?
You know, we try for flexibility. We are going to have to toe the line a little harder than we have up to this point. I know the surge threw us off and threw a lot of in-person classes into remote, and we did not push back hard on that. But students were very disadvantaged. We did hear a lot from students, especially the residential students. They're very, very disappointed to get those emails that said your class was in person, but now it's remote. And so there will always be some flexibility in the system, but you know, and we never know if there's going to be a big change that none of us know about. But if we think it's going the way it's going now, you know, we're going to try real hard to get to 50, maybe even 60% in person. We were at 70% in person. We were a 70-30 campus before COVID. And for all of the things, you know, things are changing, employment's changing, the way students even want more online is changing. So that's making us, you know, reassess the right percentage no matter what's going on with COVID. But for spring, a really good goal for us is between 50 and 60%. So there will be some flexibility, but it's all going to go through the schools and through the deans and through our office. So more to come, but lots of dialogue with faculty for sure.
Thank you. And we have another question about, will there be discourse on the vaccine on campus? Dr. Pollard, would you like to answer to that, please?
Yeah, it was interesting. I saw the question. I was thinking, I said, I wonder what that means on campus in terms of having more conversations and more activities in this space. I think what you've heard thus far is that our intent is to do that. I know that Dr. Edith has done phenomenal work mobilizing folks across the campus around these things. I'm really grateful also to our NSA for the work they've done here. So I want to encourage us that that has happened and will continue to do more of that, particularly if our college community is indicating they want to have more opportunities within the college community to talk about these issues. If you're referring to in this space right here, as it relates to the town hall, fortunately or unfortunately, the majority of this session has been about COVID-19 and the vaccine and the responsibilities we have in meeting the obligations that are placed on us, and also trying to work to keep our students and employees safe. So I guess the short answer to that is yes, and feel free to let us know what you might like to see in that space. And I want to offer something, and I loved how Adit said this. We are responsible to a certain set of guidelines and directives that are placed on us as a state instrumentality, as a publicly funded institution. We are responsible to federal dictates, state dictates, and then we also have guidelines that, as a part of our other governing body, INCHE, the Nevada State Higher Education, that we are responsible for those entities as well in terms of what we have to implement as an institution. So as I looked at some of the thread of comments that have come in and just the thoughtfulness and the responses, I want to thank you all for that. Michael Johnson in particular, as I've watched your responses as well. I get that some folks are trying to process this, and this is a very emotional experience, but make sure that your emotion and anger is directed in a way that is either productive and or in the right space. So we are trying to do the work that we have been called and are obligated to do, and we're going to do that with grace and dignity and respect, and certainly with the flexibility that we can. But there are some things that we don't have the luxury, opportunity, or interest in trying to not be responsive to. So I really want to thank you all for that. And I'm hopeful I responded to that question.
Great, thank you so much. And I do want to take a moment too to get back to Lizbeth, because you were giving us this great explanation and really critical information on what's happening in terms of supporting documented and undocumented students here on campus.
Yes, thank you, Dr. Lopez. So we have plenty of resources on campus for DACA and undocumented students. I know somebody already mentioned Laura Hinojosa. She's a great resource for all of our students, and she's very DACA friendly. And we now have Mariana, as I mentioned earlier as well. She started this week, and she will see our undocumented and our DACA students, but also in terms of like vaccines for DACA and undocumented students, vaccination doesn't impact immigration status at all. The clinics at NSC are especially undocu-friendly, and the upcoming clinics on campus are open to everyone over 12. And social security numbers or immigration status is never asked about at these vaccine clinics. And the NSC care team also has bus passes that provides routes to the nearest vaccine clinics for students. And we have 3 upcoming ones here on campus. One is on Thursday, September 9th from 10:30 to 1:30, Tuesday, September 28th from 10:30 to 1:30 p.m., and then Thursday, October 7th from 10:30 to 1:30 p.m. So those are open to all students. And as I mentioned, they are very DACA and undocu friendly. I myself am a DACA student, and I was comfortable receiving my vaccine and didn't have any problems, didn't run into any issues. All I needed was my ID.
Great. We also have a question for you, Lizbeth, on why did you choose to get vaccinated?
Yes, I chose to get vaccinated to not only protect myself, but also protect those that I care and love. So my parents actually contracted COVID back in November, and it was a very scary time for us. And so, you know, as soon as we could get the vaccine, we all went to make our appointments. And I also have a younger sibling who is not quite eligible for the vaccine yet because he's too young. And so I really want to do everything that I can in my power to protect him. If you know me at all, you know I'm very family oriented. So I want to do everything that I can to protect them, as well as protect other students and protect others on campus. So I feel like I'm doing my part to maintain a safe space here on campus. And I think that that's really important, especially now as we come back to in-person learning and, you know, want to go out to all of these events. And I think that that's just one more layer of protection that we can add. So yeah, I just want to do my part to move to a better and safer environment.
Fantastic. Thank you so much. We have a question here that asks, will a student who cannot receive the vaccine get a refund for their tuition expenses if they're not able to finish their degree due to this mandate? So Adit, would you like to take that one?
Yeah, I can start off. You know, my reaction to this question first is individual students have individual circumstances. And so we would want to talk with that student. So know that. And your avenue for that is coronavirus@nsc.edu. And there's folks behind the scenes, whether it's myself or Stephanie or Amy or Gwen or Gregory, where we're going to wrap our arms around you so we can have a conversation about what is your specific situation. What are your options? So know that first. Let's dialogue, let's talk. Every individual student has a different situation. You have to be vaccinated as a student in order to register for the spring semester. So we're going to make sure a student is not in a situation where if they haven't provided proof of vaccination, that they're registering and being charged tuition. So that's one thing to kind of point out. But what we really want to get at is, what else can we do with the student to retain them as a student? What classes schedule can we help coordinate so they finish out the degree online, as an example? So let's have a conversation about this, but know that one of the key things is registration is tied to proof of vaccination. There are avenues for exemptions for medical reasons and religious reasons. The details of that are unfolding as we speak. So reach out to us, coronavirus@nsc.edu, to kick off those conversations.
Great. Next question is, will any accommodations for testing be made on campus for faculty and students who would prefer to get testing rather than the vaccine? If not, how is this inclusive to all staff and students?
I can kick that one off too and have others join in. I referenced earlier that the testing protocol details will be forthcoming. Again, something that we're talking about system-wide. So all of our various institutions are grappling with this very question. Yes, we want to bring testing to campus. Exactly which company we'll be working with, which community agencies, we have to figure that out. It is a heavy lift. So again, thank you for being patient with us. But it is ideal to have a testing site on our campus. We're really grateful to be, within a mile away from CSN Henderson campus that has the testing and vaccination on their campus. So we have that partnership that for now we can lean on. They're, I think, a little bit over a mile away from us. We can give you specific directions on how to access, whether it's their testing or their vaccination, while we work on bringing something on our campus. That's the goal.
And then can you further clarify, because this question asks about weekly testing for students. Is that an option for students to opt out of the vaccination and get weekly testing?
My understanding is that question is being discussed right now. We have general counsel involved. That has come up from various angles. We're trying to figure out where specifically that has come up. We know that we're getting direction from the State Board of Health, and then we're getting guidance from NSHE. So that very question, we will hopefully have an answer soon to. I don't know who else would want to add to that, but that is a top priority to get clarity on that question.
I think it's important to note that the current mandate states that the student vaccination piece is a must. and that there's not that option, and to plan accordingly. So we know that November 1st deadline, and you have to keep in consideration that 2 of the 3 vaccinations require 2 doses. And that means if you haven't had a chance already, you need to hop online. You can go to our website and figure out where you can go and get that vaccination done. So that's great. Okay, we've got one last question and then we're going to have to wrap up. So this is student related. If we are not able to get the vaccine after we invested 3 years of time and money into our education, will we be reimbursed for our 3 years? Dr. Pollard.
Yeah, I'll take that one. I guess that's what they put me at the top of the org chart to be able to try and respond to it. I found this question quite intriguing because what I would offer, because I think most people appreciate thoughtful responses, is no. I do not believe or know at this time there's any legal standing for that. We are in an emergency state as it relates to a public health crisis, and dare I say, a global public health crisis. So as a result of that, as Dr. Fernandez mentioned earlier, there has been a dictate that many times started at the federal level, that has gone to the state level, and then has come to us as a publicly funded institution of higher education. The question, if you're not able to get the vaccine, let us work with you to help you figure out how to get that so that you are able to do so. There is a time constraint, and there are a bountiful number of resources that we would like to help direct you to, and have taken the time to do that. But not being able to do it and choosing not to do it are 2 different things. So if you're not able to get there, let's sit down and come up with a strategy to help you do that. We want to do that. We have a team of people that you would be surprised the amount of time and energy. I left the office last night and they were still here with blurry eyes trying to put together appropriate resources to share with members of the college community. If you choose not to get the vaccine based on the current state mandate that is there, I don't know how to help you. What I can do is to suggest to you that these are the rationales that the state, and we tried to spend the last hour doing that. Here are the resources that the state has provided, what the college has made available, what our county and region is doing. We can provide that to you. And our hope is that you will avail yourself of that and that we will see you here in January. And if you're not here in January and you're not enrolled in classes, we will miss you. There will not be a charge for your tuition for the spring semester because you will not be enrolled in classes. But we are not at this particular point able to do more than that. And I hope that we can be a part of your solution process and let us know what that can be. And we're happy to do so. Thank you.
Wonderful, thank you. And this actually brings our town hall to a close. I want to thank everyone who had the opportunity to tune in. We know that your time is exceedingly important. And also, there's so much information out there. This is one way that we're communicating with the entire campus and with all of our stakeholders. We're going to absolutely continue the dialogue, but we highly encourage you to stay vigilant out there and to absolutely stay engaged. And on behalf of the entire college, I want to thank everyone for what you do to make our students successful. Thank you again.